The Centers for Disease Control has reversed its stance on masks, saying everyone should wear them indoors, even someone who is vaccinated. Let's bring in Dr. Caitlin Catalina, epidemiologist with UT Health School of Public Health, to talk more about this. Why these updated guidelines? Does this all go back to the Delta variant?
Yeah, the Delta variant changes the game in terms of transmission. So vaccinated are now part of the transmission chain that they weren't a part of before. And we need to stop transmission at every corner in order to get this fire to stop burning.
All right, let's talk more about what's happening with someone who does have a vaccine. Let's say they're vaccinated. How many people are you seeing or hearing about who are still getting this Delta variant? And then are they able to transmit it to other people?
Yeah, so we don't have the numbers quite yet. Yesterday, the CDC came out to tell us that they do have some data showing that breakthrough cases have high viral loads in their nose and their mouth. What we do know is that vaccines continue to protect the vaccinated from severe disease and death. We see this at the local level, with hospitals reporting upwards to 99% of their patients being unvaccinated. What this changes is, like I said before, the transmission chain and the ability to pass the virus on to other people.
And those other people might not be vaccinated and might not fare as well as what we're hearing. All right, we know that school is just a few weeks away for most kiddos, and this is a debate that's been really picking up steam because we're getting so close to it, and that's should kids wear masks in schools. Can you update us on the agency's guidance on this, as well as your expert opinion about it?
Yeah, so the CDC said yesterday, as well as the American Academy of Pediatrics last week, that they recommend kids wear masks in school. We know this works. We know this protects the wearer as well as protects others around the wearer. It will stop transmission and it will protect kids. And so we continue to advocate for masks in schools to protect kids and teachers and even the community around those schools.
Now let's talk about this new guidance. Do you feel like that it could deter people from getting vaccinated? Because maybe they feel like a freedom is being taken away, and that was a big motivator. I can take off my mask if I get that vaccine.
Yeah, that was the original hope of the CDC changing the mask guidelines back in May, was it would increase vaccine acceptance, and it maybe did a little. And look, we know we're all angry, we're frustrated with this pandemic, but be frustrated with a mask on. Don't do it for the unvaccinated. Don't even do it for the never maskers. Do it for the immunocompromised. Do it for the kids. Do it for the elderly that just doesn't have the full protection they need. And once we protect those populations, we can look back on the guidelines and reassess.
I'm glad you said that. I really do feel like when you think about other people other than yourself, it makes it easier and it just makes you want to help others, I believe. All right, so let's talk about new information overnight coming in about the Pfizer vaccine, that it may not be so effective against Delta. What are your thoughts on that?
Yeah, so we have mixed information coming in from Israel saying it's low effective, and then we have in the UK saying it's still effective. And we are reliant on that data, and we're continuing to see it evolve. I think it's important that we take in population differences. The population in Israel is very different than the population in the UK, which is very different than the population in the United States. So what we need to continue to do is watch how this variant continues to transmit and the rate of breakthrough infections at a local and national level.
And I have to tell you, as a medical reporter, one of the biggest emails and questions that I get from our viewers is if they feel like all doctors are pushing the vaccine. And what I try to explain to them from what we've seen, and you mentioned the stat, 99.5% of people in the hospital right now are people who didn't get the vaccine. But then they tell me, well, I see all these people who are sick from the vaccine. Our stats are showing that it's less than 1% who have serious effects from the vaccine. Are those the numbers that you have as well? Because I just don't want people to think that we're unfairly talking to doctors who support the vaccine.
That's true. We continue to see the local numbers of low, very low hospitalization rates among the vaccinated. Those vaccinated that are ending up at the hospital tend to be more sick, have comorbidities. And so we continue to be very confident in our vaccines. it is one of the best protectors we have against the pandemic right now. And we need to approach this in a layered approach. So vaccines, masks, continuing to hand wash, social distance, and staying vigilant.
All right, here we go again. Everyone just get ready for that. We'll do what we can to all protect each other. Thank you for your time from UT Health this morning.
Yeah, thank you for having me.